Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Sofi Annasty Rachmadiani, Prodi D3 Teknologi Laboratorium Medis dengan nomor induk mahasiswa P07134122106. Today, I will tell you about what is diabetes. Get started. Diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. When your blood sugar goes up, it signals your pancreas to release insulin. Sometimes your body doesn't make enough or any insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. There isn't a cure yet for diabetes, but losing weight, eating healthy food, and being active can really help. Taking medicine as needed, getting diabetes self-management education and support, and keeping healthcare appointments can also reduce the impact of diabetes on your life. Over time, high blood glucose leads to problems such as 1. Heart disease, 2. Stroke, 3. Kidney disease, 4. eye problems, 5. Dental disease, 6. Nerve damage, 7. Food problems. There are 3 main types of diabetes. First, type 1. If the person who has type 1 diabetes, his body doesn't make insulin. The immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Second, type 2. If the person who has type 2 diabetes, his body doesn't make or use insulin well, we can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs most often in middle-aged and older people. Type 2 is the most common type of diabetes. Third, gestational diabetes. Gestational diabetes develops in some women when they are pregnant. Most of times, this type of diabetes goes away after the baby is born. Sometimes, diabetes diagnosed during pregnancy is actually type 2 diabetes. General symptoms of diabetes include: first, increased hunger, 2. Increased thirst, 3. Weight loss, 4. Frequent urination, 5. Blurry vision, 6. Extreme fatigue, 7. Source that doesn't heal. Symptoms in men. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction or ED, and poor muscle strength. Symptoms in women. Women with diabetes can also have symptoms such as urinary tract infection, yeast infection, and dry, itchy skin. Symptoms of type 1 diabetes can include extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, and tiredness. It may also result in mood change. Type 2 of diabetes. Symptoms of type 2 diabetes can include increased hunger, increased thirst, increased urination, blurry vision, tiredness, sores that are slow to heal. It may cause recurring infection. This is because elevated glucose level make it harder for the body to heal. Gestational diabetes. Most women with gestational diabetes don't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between the 24th and 28th weeks of gestation. In rare cases, a woman with gestational diabetes will also experience increased thirst of urination. What causes type 1 diabetes? Doctors don't know exactly what causes type 1 diabetes. For some reason, the immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. Genes may play a role in some people. It's also possible that a virus sets off the immune system attack. Causes of type 2 diabetes. Type 2 diabetes stems from a combination of genetic and lifestyle factors. Being overweight or obese increase your risk too. Carrying extra weight, especially in your belly, makes your cells more resistant to the effects of insulin on your blood sugar. In condition runs in families, family members share genes that make them more likely to get type 2 diabetes and to be overweight. The cause of gestational diabetes. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effect of insulin. This can cause high blood sugar during pregnancy. Women who are overweight when they get pregnant or who gain too much weight during their pregnancy are more likely to get gestational diabetes. And that's it. Thank you for listening and thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.